Welcome back to Visions for Health. Today we're going to explore some cutting-edge science in regards to methyl tetrahydrofolate reductase, which is practically impossible to say but really cool to learn about. My guest today is Dr. Richard Chen. He is a family doctor and practitioner at Visions Healthcare. Welcome.
Thank you.
Thank you for being here.
Thank you for letting me here.
So talk to me. You do primary care.
Yes.
And you do functional medicine also?
That's correct.
How would you describe functional medicine?
I would say I would describe functional medicine as looking at the causes behind things. I think in conventional medicine we look at more in terms of what disease is it, and what medication can we do for it. And I would say I would describe functional medicine as, well, maybe we can find out what disease it is, but more importantly, what's causing it in the body that's causing that to happen. Is it related to a food issue? Is it related to a hormonal issue? Is it related to stress? A lot of things are. Or is it related to in terms of how the environment is impacting the person individually? So
how did you get into functional medicine? Because this isn't something you learned in medical school or residency, correct?
No, it's not.
Okay, so how'd you get into it?
It was kind of interesting. I've been a physician for 20 years, and for most of my career, I was a regular conventional medicine doctor. Mm-hmm. But then I've always been a foodie. I love food. I collect tons of cookbooks. But anyway,
now it's all online.
I know. It's okay. I would sort of say that I saw a course called Food as Medicine. It was in Washington D.C. And I was like, it would be good if I could sort of like merge my interest of food and medicine. So I went to the course and learned about how powerful food is. Food is medicine. Food affects everything we do. It's not just a energy source. It affects it's information for our body. And then after that, I got into understood functional medicine, and then I started learning more about functional medicine. I actually went through Institute of Functional Medicine. I've gone through all the courses, and I'm actually going to get certified probably next year, actually.
Wow. I mean, that's a very extensive training program.
Yeah.
So was the Food as Medicine a functional medicine course?
It was sort of like, it was sort of a lead into that there. I think it was introducing the concepts of functional medicine there, but it was more about food in general. Had good food there too.
They fed you?
Yes, of course. That's why I went there. But and yeah, so it's been a good journey.
How many years ago was that?
Oh, let's see. I would say 5-6 years ago, probably. Yeah. So then that was. It's been then after I started doing this all this education in functional medicine, then I got sick, and then I had to use functional medicine to help myself get better, and that's been a journey too. So that's been very interesting too.
So you actually live a lot of the things that we're going to talk about today.
Totally. I think it's like it's if you live what you preach, it's a lot easier because how things are going through. What people go through. It's like, you're going to ask me to do what to my diet? And so I've done it to my diet, and I know what it feels like and the challenges associated with that.
So let's talk about methyl tetrahydrofolate reductase, which I'll just call MTHFR.
Sounds good.
Can you give me the 10,000-foot view of what MTHFR is, and then we can drill down into why it matters?
Sure. I would sort of say that gene specifically is part of it's one of the central genes in the methylation pathway. And the methylation pathway is very important because it's sort of it's involving in turning on and off DNA, which is a major part of our body. And that could be, could lead to issues in terms of autoimmune issues, can lead to cancer issues. But besides that, methylation is involved in terms of production of energy. It's involved in terms of producing neurotransmitters, which are involved in terms of how your brain works. So there's a lot more other functions of that besides that, but those are pretty major functions. And then everything in our body is interconnected, and the MTHFR is sort of like in the I would sort of say the center part of the several different pathways. And so it's only one gene out of 23,000 genes. But if you have one gene that is in the center of the pathway and it's sort of compromised, it affects quite a lot of different things.
So you just said a ton of stuff.
Sure.
So you mentioned it's implicated in cancer pathways.
Yep.
Did you mention diabetes?
It can be. I mean, the different diseases it can be associated with would be like in terms of like recurrent miscarriages.
Recurrent miscarriages?
Yep,
Okay.
be associated with in terms of like early vascular issues such as heart attacks and strokes. In terms of estrogen-dependent cancers, or like such as prostate cancer or breast cancer, but also could be in terms of other cancers in general. Colon cancer has been associated with that gene. Autism is associated with methylation issues, autoimmune issues. There's a lot of stuff.
Sounds pretty. I mean, this is one gene.
Yeah, yeah. Also mood disorders, of course. Mood disorders are very prominent too as well.
So anxiety, depression,
Sure.
sleep disorders.
Yep, yep.
Attention,
Totally.
one gene.
That's one gene.
How prevalent is this?
I would say in terms of it differs on the ethnicity, but I would say in terms of the Caucasian population, having one gene of that is like 35% prevalence. So
35%.
yeah.
So in a room full of 5 people, 1 or 2 have it.
Yeah. And it depends. You could have there's more than there's the 2 genes that we study for it. I mean, so 35% prevalence for one gene, and maybe 12% prevalence for 2 genes of that one specific thing. So it can get, and then in terms of Hispanics have higher prevalence, maybe 47%. African Americans maybe about 12% for just having one gene. So it definitely differs depending on ethnicity involved.
And do you know the one off the top of your head for Asians? Because
Actually, in terms of there is more of that associated with Asians actually. In terms of it's actually higher there. I think it's Northern Chinese have a little bit more higher prevalence of that. Actually, I had a patient who had 2 of those genes, and I sort of took care of that. And she was like coming back 2 months later, and she was totally non-stressed. And I was like, is this the same person? It was very interesting. Yeah.
So you found it related to how people deal with the stressors in their lives also?
Yeah. Oh, totally.
Okay, so it's one gene. It sounds like it's extremely prevalent.
Yes.
It's implicated in lots of medical disorders.
Yes.
You mentioned heart attack and stroke.
Yes.
What is it also with homocysteine and
Right, that's correct. So what happens is you think about how can this one gene do so much?
Yeah.
Well, the reason it can do so much is it's interconnected with other pathways, and so
it's like a train switch.
Yeah, and then so the homocysteine is that's been out in the literature in terms of how that can affect. It's actually toxic to the blood vessels, and so people who are born kids who are born with this congenital, they have elevated homocysteine. They have heart attacks at age 6 or 7.
Oh.
But I mean, most people don't have that kind of genetic issue,
right.
But they have homocysteine from other issues there and stuff like that, and so they have family history of a heart attack at age 40 or something like that, or strokes at age 40, and the cholesterol is one factor, but there's a lot more other factors than cholesterol that would be for in terms of vascular disease.
So you mentioned methylation.
Yes.
Most people aren't really familiar with what methylation means.
Sure.
So can you say a little about A, what it means, and B, why it matters?
I would sort of say methylation is these are good for the people who are like biochemists. But methyl is it's actually like a carbon and 3 hydrogen groups in there, and it's a very simple molecule. But I would sort of say you have to look at it in terms of your body. Your body has a language of its own, and the methyl is how your body uses to turn on and off DNA. I mean, we have a lot of genes in our body, and not every one of those genes is expressed. And methylation is how your body uses that to sort of make things, okay, I want that gene on, I want that gene off. And so think about it. If your language, if the substance of your body that turns on and off things isn't working well, then there's a lot of dysfunction happening on there because your body doesn't have the right substances to control things.
So you're not getting the right messages, do
Correct.
this or don't do this.
Right.
What are there vitamins and minerals that are involved in methylation that the general public might know about and say, oh, I've heard of that?
Yeah, it's like folic acid. Folic acid is like the MTHFR is evolved in terms of making folate active in your body. We have this in the United States. We had the supplementation with folic acid to help prevent pregnancy-associated neural defects.
Yeah.
But it's a little more complicated than that because every person is different. I said to talk about the prevalence of this specific gene. Some people have 30. If you have this specific gene, and you cannot convert folic acid to the active part, then being supplemented with folic acid may actually be harmful to you because it's not giving you the right form of folic acid.
Right.
And so folic acid is something that's very common, and then I would sort of say that's there. And then different vitamins associated with that, B6, B12, all those are all associated with this kind of pathway. Not specific for that one there, but they can be, yes.
So can people take the activated forms of the B12, B6, and the folic acid?
Yes, they can. I mean, I think some people, like, you can, I would just be cautious with that there. I mean, some people, like, it's just like the interconnected of the body. I mean, this pathway is connected with how your body deals with the environment and dealing with metals and stuff like that. So I would not usually just say, oh, take this and see how things go with it, because it has effect on your body. I mean, this is affected in terms of how your body deals with metals. So if you have a pretty heavy metal burden in your body and you take this, and you may have side effects from it. So it's like, even though it's a over-the-counter supplement, it still has effects, and it's not something I would do. It should be done under medical supervision.
Okay.
Yeah.
So you mentioned that there were two main MTHFR genetic mutations. Can you say more about that?
Sure. So one of them is called the C677T, and that one is more associated in terms of the pathway, in terms of the homocysteine, as well as involved in terms of how your body produces glutathione, which is like one of the main intracellular antioxidants in your body, and that can be associated with helping your body deal with environment. The other one, which is interesting, is called the A1298C, and that's sort of more involving in terms of neurotransmitters, more specifically serotonin and dopamine. Serotonin is very interesting. It's one of my favorite neurotransmitters, but it's actually, a lot of people are on SSRIs, and that's called a serotonin reuptake inhibitor. That helps sort of people stop the breakdown of serotonin. Well, I would say this gene is involved in terms of the production of serotonin. So if you have one of these genes, you may have less serotonin production. And
so that means you're more likely to be anxious or depressed?
Yeah, you're more likely to be anxious. You may crave carbohydrates like breads, pastas. You may have trouble sleeping. You may get more moody during wintertime and everything. And that's one part of it. The other part is more in terms of dopamine. Dopamine is involved with concentration, with focus. That can be associated with attention deficit disorder.
So when you're seeing a child in the office for a consult or for their annual pediatric visit,
Sure.
is this sort of like a filter that you're looking at when you're talking to the parents and saying, do they have trouble with attention? Do they seem moody? Do they have food cravings?
I think when I talk to a patient there, I always try to assess their mood because how their mood affects everything they do. And if they have some issues that makes me think of certain neurotransmitter issues going on there, then I can look more at the genetics too. So I would offer their genetic test depending on whether they have issues that might benefit from that testing, perhaps.
How do you do this testing? Is it saliva? Is it blood? Is it urine? How do you get this?
You can do it several different ways, and there's the different pros and cons. I mean, right now at Visions, we do offer the testing more through blood, and some insurance companies cover for it. Right now, we use a more specialty laboratory so that we don't have to deal with the insurance company so much. But it's pretty inexpensive test, only $35.
$35 for a blood test?
Yeah, for a blood test which is genetic, which is not bad because
that's cheap, right?
Because the insurance company, if it doesn't cover it, it'll charge you a couple $100s. So It's a good deal.
That's a really good deal.
Yeah.
This is SpectraCell, right?
That's correct. Yes.
Okay.
Yeah.
So one way is blood. Are there other ways that you can test this?
You can. You can do it also through saliva testing. I mean, 23andMe offers a sort of a large. You can do a saliva test, and then you can sort of run that through different websites to give you more genetic information there. You get a lot of information. That's only about $99, so it's a good deal too. But then you usually have to sort of that has so much information. You really need to do other tests to see whether, genes are they're kind of they're like a blueprint, and you don't know whether that blueprint is really being expressed or not and stuff. So I mean, if you did a test for the genetic test, which was like maybe 15, 20 genes, you have to know whether those genes are being expressed. So you have to usually do other tests on top of it to sort of see whether those genes are being expressed in the body or so.
So it's almost like too much information.
Yeah,
some
yeah,
people.
definitely. It's a lot of information in there. It takes a while to process through.
Okay, so we've gone over, there's this methyl tetrahydrofolate reductase. It impairs methylation, which means that certain on-off switch aren't functioning properly.
Right.
And there's two main ones.
Right. Well,
One's
yeah, that's correct. Right.
A1298C and the other is C677T.
That's correct. Right.
And the A1298 is more serotonin and dopamine and mood and attention and sleep. And the C677T is more of the, sounds like heart disease.
I would sort of say, I mean, it could be heart disease, it could be involved with the energy issues, it could be deal in terms of not doing well with the environment there. So it's, I mean, it's that C677 part there, it's evolving, turning on methylation itself. So there could be a lot of different issues going on there, yes.
Have you done this on yourself?
Yes, I have.
Is ignorance bliss?
It's sort of like, I found out, you know, it's like, you know, I fit my, you can get a lot from history, actually. So, you know, I always try to correlate what I get from talking to somebody and how it fits with their profile. And so I fit my profile.
So how would patients dance with the information they get? Did they have to see a doctor for this, yes?
I would say yes, yes, yeah.
Okay. And then when people see, I mean, is this like a death sentence, or is this something people can really work around?
No, I think, you know, I think genetics gets a bum rap because, you know, we think that if you get a certain test that, oh my God, this tells me this is a gene for depression, I'm going to get depression. It's like, no, these are potential things. You know, this is one gene out of 23,000 genes. What's the rest of the 22,999 genes doing otherwise? But I would say, you know, it gives you a snapshot in one part of your body there, and I think you can do something about it, perhaps, which is a good thing. I mean, if you did this, if you got the data, and you couldn't do anything about it, then it would be very demoralizing. Because what's the point?
Right.
But if you can get the data and sort of figure out, well, let's see if we can do something about this, then it's cool. I mean, I had one person who I thought had issues. Actually, they had issues with bowel function. He was like a young kid, and he had problems with bowel function. And serotonin, I mean, it's like we think of it more as depression, but it's also, serotonin is also the neurotransmitter for the gut. So he had problems with bowel function, and you know, I gave him some supplementation for that, and he's like, the mom's like saying, wow, his bowel function is totally normalized. That was like first time in his whole life, and I was like, that's pretty cool.
Dr. Stein was on another show here and was talking about serotonin and how much of it was in your gut.
Right, right.
And that it's really like your second brain.
That's correct.
So do you find when you're working with people that you can help improve anxiety or depression or risk of heart attack and stroke? And are these things that you find improve?
Yeah, totally. I mean, I've only been doing functional medicine more in the last couple of years or so I don't have the time frame yet, but I would say just the time frame that I've been doing it more full time, definitely I see the anxiety and depression being totally helped at this point there. I mean, people are like, you know, I mean, that person I talked about 2 months late after I saw her, she's like, she was a totally different person. The way she carried herself in terms of, it was just like, she seemed so relaxed. Are you the same person? It was kind of funny.
Can you say a little about the types of interventions you did with her? You didn't put her on an antidepressant or an anxiolytic. Okay, so what did you do with her?
I believe for her I did is like, you know, so she actually had 2 genes for the C677, and so, but I think she also had some other mineral deficiencies and stuff. So what I did is I probably corrected more of the mineral deficiencies first. So sort of, you know, and another topic is like the minerals are quite powerful for the body, because each mineral is used by the body a couple hundred different ways. So I probably gave her some mineral supplements there to make things better for that.
Can you say a little about the ones that you're particularly looking at?
I think the minerals I'm concerned about mostly is like magnesium. That's like a mineral which is affected by stress. When a person is stressed, they lose magnesium. And it's involved in about 300 reactions including muscle tension, energy, and it's just very powerful. And I've had cases where I just give a patient 2 minerals, and they do much better in just 2 months, just with giving 2 minerals.
What's the other one?
The other mineral is zinc. Zinc is involved in your immune system. It's involved in about 200 reactions, and it's also a cofactor for one of the main inhibitory neurotransmitters in your brain. So most people are like the way the culture is. We're always trying to get things done, and that sort of stresses your body out. Your body doesn't really want to be stressed out. It tries to calm it down, and their ability to calm themselves down decreases. And if they have the less of a zinc, which is a cofactor in terms of that, they need to get back into your system so that they can calm their body down.
Okay, we have to review this because that
Sure.
was really cool. So
Sure.
zinc is involved in a neurotransmitter that's inhibitory.
That's correct.
And when you say inhibitory, you mean that it calms you down?
Right, right.
So if people are low in zinc, they might have a hard time calming themselves down or focusing?
Yeah, so actually I see this a lot in people who with the attention issues too. And let's say they have attention issues, and you would think what happens is their mind races. So their mind is usually like always thinking. They can't, it's easy to get stressed out. It's hard time to relax itself. And so basically it could be, you can do stuff for it nutritionally as well as supplement-wise, and the nutritional is more easy for most people to take.
So magnesium and zinc?
Yeah, yeah.
That's it?
Well, I would say those are one of my baseline minerals that I always try to assess at every patient there.
And what are some of the other ones that you find are important in terms of balance and dancing with MTHFR?
Not specifically for, well, I think, if people who have MTHFR may have issues in terms of stress in general. I mean, I would say those are the main things for minerals there. I mean, definitely, you can think about all the other minerals. You can, vitamin D is helpful for your body.
Mm-hmm.
That may affect the serotonin issues too. But I think, for the MTHFR itself, it's mostly the B vitamins that are associated with the MTHFR.
So you check, when you're running a panel of blood on a patient, you're checking their B vitamins as well. So you said B6, B12, and folate?
Yeah, it's kind of tough because I think the testing for that by blood is not so. The B12 you can, and then the other B vitamins, it's tougher. So I mean, I think I sort of do that by empiricism. I sort of like, well, I mean, it's not going to hurt you to get some additional B vitamins. Mm-hmm. So usually I just do put them on that. So
you don't always test. It's sometimes a...
No, I think economics plays a factor sometimes, mm-hmm. and I'd say it's not always about testing and treating. Sometimes you can treat and then sort of see how things go with that too.
Okay, so it's unlikely for people to harm themselves with a zinc and magnesium addition. Right. Can you overdose on those?
Yeah, it's kind of interesting with the zinc is that your body is interconnected. So there's nothing you do that only affects one thing. Mm-hmm. So when you do zinc, it affects the minerals like copper. So everything is done in balance. There's nothing like, oh, this is a good nutrient, this is a bad nutrient. So you monitor it and see how things go with that. Okay. Magnesium, it's like, if you have kidney problems, you definitely have to be more careful with magnesium. But otherwise, I would sort of say you can do pretty well with it. Some people, they take too much magnesium, they may not do too well in terms of bowel issues. Mm-hmm. So if they have more looseness going on there, then perhaps they should sort of cut back on the dosage perhaps there.
Okay. So you say to people, you've taken too much when?
Yes, yeah. Okay. I have to phrase that very well when I do that.
Got it. So this is cutting edge science.
Yeah, they just actually had a seminar in Seattle, just about 3-day seminar on methylation. Unfortunately, I was too conferenced out and I didn't go to that conference, but I'm hoping to get the DVD and learn from that there because I've heard from people who have attended it, and I think genetics is a new frontier for medicine, mm-hmm. and if you do it right, you can get some improvement. And I think genetics is, again, it's a potential. It's not about saying this is what it's going to be. This is what it can be, but I can always change it too.
You mentioned something about estrogen-dependent cancers. Can you draw the line to connect those dots? Because that, for our audience, may not be an obvious connection.
Sure. So, I mean, I think, like I said, methylation is a very important process. methylation can also is used sort of to get rid of certain things in our body. And one of the things is in terms of the estrogen. Estrogen, in order to get to be metabolized, one of the processes it gets methylated. There's a different enzyme for that, COMT for those people who want to know about that. But otherwise, and so if you have a problem with methylation, then estrogen goes higher. And then if the estrogen levels go higher, then you have problems in terms of too high of a level of the estrogen can cause issues. I mean, definitely you know about breast cancer, we know about uterine cancer, prostate cancer. I mean, it's still so up in the air, but I think there's a lot of literature that says that estrogen is an issue in terms of prostate cancer.
Because you're not able to properly process what you have, and inappropriate levels build up, and that
Correct.
raises the risk of cancer.
Right.
And
right.
people who are poor methylators or who have the MTHFR genetic mutation are more at risk or have a harder time methylating.
Right.
So this is detoxification,
essentially?
Yep.
It's detoxification and biotransformation, how your body gets rid of stuff going on in your body, because your body has to, your body unfortunately produces stuff that is not good for it, and it has to sort of get rid of those substances.
This is a very rich topic, I think.
Yes, it is.
We have limited time left. Is there anything that I haven't asked you that I should ask you? Actually, I have a bunch of questions, but I'll let you talk.
I think I say, I'm interested in the genes, but I would sort of say one thing about this, like when we talk about the methylation, we think, oh, this means I have to take a supplement forever or something like that. I would just say, it goes back to the basics. Your lifestyle affects things. Mm-hmm. I mean, people who have this gene issue there, if they live a clean life there, they try to eat more, whole foods and stuff. I mean, in terms of, from the land, not processed food. They have a low stress lifestyle. That affects them. So it's not all about, just take care of the gene, you'll be all set. It's about your living. Mm-hmm. Your living is what counts, because you can't take the right supplements and then sort of have a very stress-filled, life and say, well, I'm all set now.
Right.
Right.
Now you are accepting new patients?
Yes, I am.
And you basically see people from birth till as old as they get?
That's correct.
You accept insurance?
Yep, yes I do.
And you're based in the Visions Healthcare in Dedham?
That's correct.
Awesome. Thank you for joining me.
Thank you for having me here.
Thank you for watching another episode of Visions for Health. My guest today was Dr. Richard Chen, an expert in methyl tetrahydrofolate reductase.